In a moment that would echo through the corridors of power and reverberate across the nation, Robert F. Kennedy Jr. stood before a gathering of reporters, health officials, and concerned citizens, announcing a seismic shift within the nation's health agencies. The news was stark, a drastic reduction in the workforce from 82,000 to approximately 62,000 employees. The implications of this decision were far-reaching, touching not only the lives of those who would find themselves without jobs, but also the very fabric of public health in America. Kennedy's announcement was met with a mixture of disbelief and concern. The U.S. Health Secretary, tasked with the unenviable job of defending this radical downsizing, framed the cuts as a necessary measure to streamline federal bureaucracy. In a climate where internal opposition to the administration's agenda was mounting, the Secretary argued that the reduction was essential for fostering a more agile and responsive health system. Yet, as the words left the Secretary's lips, they hung in the air, heavy with implications. The closure of half of the regional offices was particularly alarming. These offices were the lifeblood of local health initiatives, often the first line of defense against public health crises. Kennedy, however, was resolute in his vision. He asserted that these changes were not merely about cutting costs or reducing headcount, they were about realigning the organization with its fundamental mission. He spoke passionately about the need for a renewed focus on the chronic disease epidemic that had been quietly ravaging the nation. The statistics were staggering, with millions suffering from conditions that could be mitigated through better public health strategies. In Kennedy's view, the existing structure had become bloated and inefficient, lost in a maze of bureaucracy that stifled innovation and responsiveness. The introduction of the new agency, the Administration for a Healthy America, AHA, was a cornerstone of Kennedy's plan. This agency was envisioned as a streamlined entity designed to cut through the red tape that had long plagued health initiatives. By consolidating resources and focusing on core priorities, Kennedy argued, the AHA would be better equipped to tackle the pressing health challenges facing the nation. He painted a picture of a revitalized health system, one that would prioritize preventive care and community health over the reactive measures that had characterized past approaches. Yet, as Kennedy laid out his vision, the skepticism in the room was palpable. Critics questioned whether slashing the workforce and closing regional offices would truly lead to a more effective health system. They feared that the loss of experienced personnel and local knowledge would create gaps in service delivery, particularly in underserved communities that relied heavily on federal support. The health secretary's assurances that the AHA would fill these gaps did little to assuage their concerns. The announcement sparked a national debate, with advocates for public health rallying against what they perceived as a dangerous precedent. They argued that the cuts would disproportionately impact vulnerable populations who were already facing barriers to accessing care. The fear was that in the quest for efficiency, the administration would overlook the very communities that needed the most support. Kennedy's vision, while ambitious, was seen by many as a gamble that could jeopardize the health of millions. As the dust settled on the announcement, the implications of these changes began to unfold. Employees faced uncertainty about their futures, while health advocates mobilized to challenge the administration's direction. In the midst of this turmoil, Kennedy remained steadfast, urging the nation to embrace a new approach to public health, one that acknowledged the urgency of the chronic disease epidemic and sought to empower communities rather than diminish them. Whether his vision would come to fruition or lead to further discord remained to be seen. But one thing was clear: the landscape of American public health was on the brink of transformation.